Hello everyone, my name is Jinan Gattas. I'm a young Einsteiner, and today I will be interviewing Dr. Natasha Azzopardi Muscat. Thank you, Natasha, for being today with us.
My pleasure.
Now, Dr. Natasha is the Director of the Division of Country Health Policies and Systems in WHO Europe. Thank you so much. So, Natasha, could you share with us one or two challenges that are faced by the Division of Country Health Policies and Systems that you lead?
So one challenge is a challenge I think associated with success, or I try to see it in that way, which is that since the COVID pandemic, the number of member states coming to WHO Euro and requesting our support has really grown. Before the pandemic, most of our work was focused on the eastern non-EU part of our region when it comes to country support. And now that has changed, and that we see that all countries are really struggling with, for example, transformation, with how to better leverage digitalization, with issues around mental health. So that is one challenge, the challenge of really trying to be there for all 53 countries when they need us to offer the support. The second challenge is when it comes to timely data. We still find ourselves in a situation where we would like to have far more timely data, far more modern data gathering approaches to be able to provide real-time navigation through the health system and feedback on the performance. And it's an area I think that we can be more effective in our work if we were able to have more data, better quality data across all of the region. We have gaps in some countries, as well as the issue with the timeliness. More and more policymakers want data that is real, that is now. And this means that we're going to have to move away from traditional means and embrace new approaches and new tools and methods.
That's a very interesting and relevant point that you mentioned, because it was also an issue that was mentioned yesterday during the CDC foresight session. So timely data is obviously an issue that we need to work on. Based on what you mentioned as challenges, could you share with us an initiative or an innovation that the division is working on or closely monitoring that help addresses these challenges?
So, for example, I mentioned mental health and the fact that all countries really require support because of this wave of mental health conditions, particularly in the younger people, but also in older persons, that has emerged in the aftermath of the COVID pandemic. And here we have set up a pan-European mental health coalition, where we basically bring member states, civil society, academic centers, users with lived experience, different sectors together. We say mental health is everybody's business, and we try to bring these different groups to work together and to make progress together and learn from each other. So this is a kind of new mechanism that we've put into place, where we are trying really to just create the space and provide the leadership and support for these different groups to come together and innovate.
Yeah, and creating and maybe keeping the momentum for mental health for all.
And I think, you know, it's a buzzword, but it's happening in practice. It's this concept of social participation, co-creation, that is not this top-down approach, but that we are moving forward together.
Thank you. I would also like to focus a bit on the topic of inequities, because it was brought many times during Geisstein Forum. What are one or two strategies that the division is working on to address inequities?
So this is a very important area for us. One of the two overarching objectives of our European program of work is leaving no one behind. And we have inequities between countries, we have inequities within countries, we have inequities within groups. More worrying, these inequities have grown since the time of the pandemic. And even more worrying is that because of the health inequities, we are seeing stagnation. When we see stagnation in certain health indicators, as soon as you dig below that average is basically showing you that what is driving that stagnation, or even a reversal of the health gains that we have made, it's usually concentrated to particular groups in society, whether they are lower educated group, marginalized, racial minorities. So you really need to focus over there. But also what we are seeing, for example, is that in this drive we did an analysis of countries' plans to digitalize, to go green. There isn't a sufficient equity lens. So what you see is that the policies are not yet sufficiently attuned to ensure that we are really taking care of the needs of those likely to be left behind. Of course, there are larger debates also. We are working with UNDP, for example, to reshape the debate around fiscal policy and taxation. We are trying to promote the economy of well-being. And ultimately, what we do know, we have statistics that show that there has been a loss of trust, but the loss of trust has been much higher in people who are out of employment and in the lower social and economic groups. And this ultimately threatens not only economic prosperity, but also social cohesion.
Of course. So to wrap up, maybe I would say we need to have timely data. We need to have preparedness to be able to respond quickly to countries' needs. We have inequities and we have mental health, right?
And we need to continue making sure also that organizations like WHO are supported to continue to be the advocate, independent advocate for the health and well-being for all people, irrespective where they reside.
Of course. Thank you so much, Natasha, for today. Thank you, everyone.
Thank you.